Okay, Shelly said I'm one of the special agents with DEA at the Flagstaff post of duty. I cover pretty much all of northern Arizona, and we see this phenomenon of synthetic drugs, or specifically bath salts and herbal incense, here in Coconino County, Navajo County, and Apache County as well. Next slide. Synthetic drugs, there's a whole myriad of them, and from ecstasy, methamphetamine, cocaine, all essentially have the same properties in that they're hallucinogenic and mind-altering chemicals. Some of them adapt for commercial distribution, commercial names that we know like Ivory, Wave, and something that would appeal to an ultimate consumer, whether it's in a head shop or on the street. Next slide. Now we've seen today, actually on ABC 15, did a report on a case in Yavapai County, and Lori Merrill from the Arizona Republic has done stories on bath salts that are sold in smoke shops or paraphernalia shops as well for as little as $14. And pretty much like with all recreational drugs, they can be smoked, snorted, or injected. The powerful designer drugs sending users to emergency room increasing numbers. Unfortunately, this is one of the ways we measure how the popularity of these drugs when we see a spike in these ER visits. Next slide. And like with all synthetic drugs, they have long names. Fortunately, we abbreviate them for people like me. MDPV, also known as provanolone, is a powerful psychoactive chemical drug similar to Ritalin, which acts as a stimulant, much like Ritalin does, and affects the dopamine and other chemicals in the brain to determine serotonin levels. These drugs work much in the same way that ecstasy does, or MDMA. Next slide. And with all drugs, whether they're synthetic drugs or they're illegal drugs, the ones that we see as heroin, cocaine, or methamphetamine, they have street names, and the street names vary by region. So what they call them up here in Flagstaff or Navajo County, they might call them something different in Maricopa or Pima County. But essentially, for commercial popularity, we see these popular names: Vanilla Sky, Snow, Ivory, Wave, Ivory Coast, Purple Wave, and like I said, they're all generic to one specific thing, and that's bath salts. Next slide. And then for the purposes of getting around law enforcement, around government regulation, we see them sold as different things, and almost all of them will have some sort of packaging material that will say that they're for novelty use and not for human consumption. So they might come under disguise as a plant food or a glass cleaner, or simply bath salts. Most often sold in milligrams, 250 to 500 milligrams, depending on the name or where they're purchased from. Next slide. So the internet being as big as the world, we see that as being the largest sale point for most of these things. So they're frequently sold online. They're sold in tobacco or smoke shops as novelty items. If you buy them on the website, like everything else, like Sam's Club or Costco, if you buy in bulk, you get a discount for buying 50 to 100 packets more in the discount rate. Next slide. So this appears, from a street point of to be in interviews that we've done with people who use them, it's extremely addictive. From an enforcement point of view, when I talk to crack addicts, the urge is almost uncontrollable for another hit immediately, and this is consistent that we see with crack cocaine, quite frankly. Several times stronger than cocaine when snorted. Next slide. And the interesting you see is as Shelly goes through these slides, and she has put some of the packaging materials on the top of them, you can see how they look very legitimate. In fact, from a marketing perspective, people want to buy these things because they are in attractive containers. They seem, very legitimate and non-harmful in any way. Like all good drug habits, they usually either start in California or the United Kingdom. And this is no different. And we see it showing up here in Arizona and on the West Coast, and the Midwest is experiencing a problem with it as well. Next slide. And it could be marketed as virtually anything, anything that would appeal to somebody as an appetite suppressant, a weight controller. In the UK, this specifically, we've seen some terrible results as far as individuals, obviously dying from the consumption of it through its use or the effects of it post-use. Next slide. And reports come across the country as far as individuals who have used it and the bizarre behavior. I think this is from a law enforcement perspective. When law enforcement gets called to somebody who's using this, we don't know what to expect because it affects everybody differently, from a very passive reaction to a very violent reaction, not only to law enforcement but to people that an individual who's used this knows, and you can't judge on how it's going to be. The hallucinations, the agitation, the acute paranoia that goes along with it are all very much a danger to everybody. Next slide. And once again, a sheriff in Mississippi wanted to see a local ban on the Ivory wave products. Became very popular in the community that they work. They see the psychotic behavior that exists. And a statistic out of Louisiana with 125 calls to the poison center in 3 months regarding bath salts, which led to a state ban there. And then one of the next things we see is this herbal incense or synthetic marijuana that has come out. Next slide. And once again, as we mentioned before with the bath salts, we see this come under a myriad of commercial names listed there on the slides. And once again, it's regional, so no one name goes with anything, not only locally but even nationally. And it's sold in a variety of different colors, in a foil pack. Generally, this is a chemical that's produced in a lab in a liquid form, and it's ultimately sprayed on spices, on potpourri, on whatever that they have. Next slide. And these are some more names that we see. Sometimes the more bizarre names, sometimes just with any marketing thing, the more they think it'll appeal to the consumer, such as Yucatan Fire or something like that. Next slide. And then sometimes they'll mix their version of what they believe synthetic marijuana is with other drugs, and there's no government control. It's not tested. The circumstances that the chemicals are made aren't made under any kind of regulation, so who knows what you're going to get. Because it's not fit for human consumption, don't forget. Next slide. And with K2, much like bath salts, we're seeing the side effects that mimic a marijuana high, but usually much more amplified with hallucinations, seizures, coma, vomiting, numbness, and an increased respiration rate. And then the doctor can speak to all the things that can go on if somebody has a pre-existing condition that these drugs may induce. Next slide. Much like bath salts, we're seeing this particular synthetic drug sold in tobacco shops or head shops or convenience stores. It's not sold as incense, not for human consumption. $45 for 3 grams is pretty pricey. can be smoked, can be mixed with food or drinks, but either way you're going to absorb the chemical in your system. Next slide. It was developed by John W. Huff, who's a legitimate researcher for NIDA. Was never tested on humans or approved for humans. It was never intended to. This was strictly a research type product that the doctor produced and got in the hands of people who decided to make a profit off of it compared to others. Dr. Huff said in an interview to WebMD, it's like playing Russian roulette to use these drugs. We don't know a darn thing about them, and they shouldn't be out there. And in Arizona, we have isolated 5 specific compounds that the legislature in the last session has made illegal. And these chemicals are easily changed by altering their chemical structure, which usurps the state law and the federal law. Next slide. As I mentioned, the formulas are always changing, and the purpose is to avoid prosecution by law enforcement. Essentially, the results are going to be the same, and it's difficult for law enforcement or for probation officials or parole officials to detect these kinds of things. It's difficult for members of the ER when an individual goes into the hospital with these reactions to determine specifically what they're under the influence of. Next slide. We picked up this story yesterday, and Shelly posted it, where USA Today reported 14 Coast Guard cadets were dismissed for using fake pot or spice. So it hits all segments of our communities. Last year, there was a report from the Air Force Academy where they had several instances of cadets using it, resulting in expulsions. So it hits all segments of a younger population. Next slide. As I mentioned, it is illegal both federally and under state law. And it's a changing epidemic that we're dealing with these 5 specific chemicals that have been mentioned under state law. When you make something illegal, both either federally or by the state, you have to specifically identify the salt and the isomer in the code so an individual knows what they have may be violating the law. Next slide. And like with all drugs, nobody does it as a community service for distribution. There's a profit margin that goes along with it. And in this particular case, we're seeing it grow dramatically. $1,000 to $10,000 daily is a huge profit margin. And then, you know, even overtly mentioning that K2 or spice as a stealth type of marijuana. Next slide. Buy one, get one free on all Herbal Incense, featured on different products. Obviously, it's not Herbal Incense. You're paying a tremendous price for something that you're going to burn just to change the odor in the air. But it's all about marketing, and the more they can market and appeal to people, whether it's in the container or the availability of the product, the more that, one, they're going to get you as a captive audience, they're going to get you hooked, and 2, they're going to make money. Next slide. Our 2012 efforts, and it's interesting that we came up, Shelly had spoken to us about the name for this particular seminar, and it is a race to keep up because we are always one step behind. So the title of this talk is very fitting. We can continually try and catch up and force the legislature or cause the legislature to, and the Congress. There's a bill in Congress right now. It's stalled before the Senate to increase the amount of drugs that are illegal. But we have to do more than that because law enforcement clearly is not the answer to this problem. Education is. So our efforts predominantly from DEA's perspective would be increasing the public awareness of this issue so we can get people aware of it and we can educate young people. And that's what I have.
Thanks, Jim. And don't forget, you can ask questions on your webinar menu in the question tab. So if you have questions as we go along in the webinar, please go ahead and fill those out, and we'll get to them as quickly as we can. Next is, what are hospitals seeing with regard to synthetic drugs? So we're grateful to have Dr. Dan Brooks from Banner Poison Control to give us an inside look at what hospitals are seeing and how these patients are presenting themselves in emergency departments across our state. Dr. Brooks?
Thanks, Shelly, and I appreciate hearing from Special Agent Molesa. Thank you so much. Yeah, we've been tracking this at the Poison Center here in Phoenix for the last couple of years because both of these agents started to show up on our radar in 2010. We had heard about it from other poison centers across the nation. As a special agent had said, it started always in California. We've been tracking it at international toxicology meetings from Europe, and then we started to see it on the East Coast and Southeast United States, and then in 2010 it made it here into Maricopa County as diagnosed by CallStar Poison Center. And there's always a lag time between what's being used or abused in the community and what's reported to poison centers, because even if these patients end up as emergency department patients or even admitted to the hospital, what they've taken is not always known. So there is a lag time, typically of months, if not a year or so, before we start to register these cases. Next slide. So this is one of the products that we actually confiscated off of our patient. We've taken care of a number of patients on our service who have come in either sick or potentially very sick from using bath salts, more so than K2. We've taken care of patients with K2 ingestions as well. And this is one of the more common products that we were seeing about 6 months ago or so here in Maricopa County. So like the special agent had mentioned, bath salts are derived ultimately from a plant alkaloid. There's a plant that grows in Eastern Africa in the Middle East, and it got a alkaloid in it that is very similar to cocaine, which is a plant, obviously, a plant alkaloid from South America. And this cathinone has been used for thousands of years as a stimulant. And when used in a natural form or at appropriate doses, one could think of it as a Ritalin, which was mentioned earlier in the talk, or even as a caffeine, which I'm sure many of us are using or have used today. But it's when you synthesize it or make it what's called man-made or semi-synthetic, and you take the plant alkaloids out of nature and then start to produce it in a lab, you concentrate the effects of the drug, and then the stimulant starts to become much more toxic, and it starts to have similar clinical effects as more common stimulants that we're used to, like cocaine, amphetamines, methamphetamine, or MDMA, which is ecstasy. But when you think about it at a baseline level, they have the same effects within the cells of our body, and therefore patients typically present with very similar clinical scenarios with signs and symptoms of toxicity, and we end up treating them the same, whether it's in the emergency department or in the intensive care unit. Next slide. So you start to see the change in the number of bath salts, and this is from the American Association of Poison Control Centers. Now, our poison center here in Phoenix is one of 57 certified poison centers across North America, and you can see that the numbers really started to be tracked in 2010. There was just a couple in 2009, but it really started to become an issue in 2010, and then obviously throughout 2011 the numbers took off, and they peaked in the early summer of last year, and they've started to decrease. And a lot of that, we think, is due to the recognition that it is an illegal substance, as well as, I think, inevitably to consumer knowledge, such that either folks are staying away from it or folks are gaining experience on how to use it and therefore are not having toxic effects and don't come to our attention. Next slide. locally, you can see this is even more dramatic. We only got 2 calls about bath salts in 2010, and both of those were what we call human exposures, meaning people weren't calling just for information about it, or law enforcement agents weren't calling just to ask us questions about it. They were actually about patients who came in saying that they had used bath salts and had clinical toxicity. And as you see, that number has grown tremendously over 2011, where we've had 266 total calls and 241 human exposures, and we've had several dozen patients that were either admitted to our hospital or flown down to us to take care of, and have spent anywhere from 1 to 3 or 4 days in the intensive care unit recovering from the effects. Next slide, please. The next, talking about K2, again, these are some of the more common packets that we have come across, and I agree with the special agent. In essence, this is supposed to be marijuana. Next slide. And when it was originally developed, it was specifically to do research in the lab and with animals on marijuana receptors. And it was, you know, it wasn't until it was synthesized, again, by non-professionals, meaning clandestine drug dealers, that we started to see some of the other problems, which we'll talk about in a little bit. You can see the same kind of increase in numbers. We knew this was just a little bit before bath salts. In 2008, 2009, we had some lower numbers. 2010, we really started to see an increase. And then 2011, it increased to almost 200 calls. And we expect to have somewhat less calls this year, but we're not sure yet. And again, it should be marijuana effects. You know, unfortunately, what we've seen and what's been reported to us through the Poison Center is non-marijuana-like effects. And a lot of these folks who have subsequently come to our service, we've been able to do comprehensive drug testing, which is it's the same equipment that's used by the CDC and the federal government. We have a very sophisticated lab at our Poison Center, and it allows us to pretty much get a fingerprint of the drugs that are in the patient's urine. And often we do find marijuana-like compounds, but sometimes we end up finding other drugs like cocaine or amphetamines. And it's our experience that a few of the patients that have more profound effects from spice actually end up being exposed to methamphetamine or amphetamine. And the classic scenario is someone goes out on the street, this spice is a new drug, they say they want to buy it, they spend a lot of money, like the special agent had mentioned, and in fact what they're getting is methamphetamine, and then they have adverse effects, and they show up in the emergency department or they're admitted, and then we end up telling them, well, you know, you're trying to buy spice, but what you actually ended up ingesting was methamphetamine. That being said, we have had a couple of patients with isolated exposures to spice that have had weird paresthesias or numbness and tingling in their hands and legs that have lasted sometimes for a day or two, and we've been unable to explain that up to this point. Next slide, please. So, you know, just to
go ahead, Dr. Brooks.
Yeah, just to sum up what we're seeing, the spice cases are typically the patients aren't that sick, and when they are sick, it usually is an exposure to a stimulant. But going back to the bath salts, those are the folks that we see that end up being pretty sick and having even permanent injuries. And these folks can present with seizures, high blood pressure, tachycardia, rapid respiratory rate. And if they become agitated and delirious, they can end up having muscle damage and muscle breakdown, which then puts them at risk for acute kidney failure. And we've seen that several times, and we've had some patients that have been sick and spent several days in the intensive care unit. So again, I agree with the Special Agent Molesa completely that these are just potentially dangerous drugs for lots of different reasons, other than being clearly stimulants, but also never knowing exactly what you're getting, or even the quality or the quantity of the drug that's being manufactured. And that's it's put a lot of patients and a lot of people in our community at risk. And that's all I have.
Good. Well, thank you, Dr. Brooks. And one of the things I wanted to ask you is there a specific age group that you see mostly using these synthetics?
Yeah, our age group here in Arizona is in the late 20s to early 30s. Nationally, the age is just a little bit higher than that, maybe early to mid 30s, which, you know, I defer to the special agent, but to us, it suggests that this is a more seasoned substance abusers. We do have young adolescents and the teens that we've taken care of, but our average age is in the late, right around 30, 29 to 30, which is just a little bit younger than what the national average is. But we can't forget that these are only the patients that poison centers are made aware of. This is, you know, the typical tip of the iceberg, where for every 1 or 2 patients we hear about, there could be dozens more that are using it, some of which never are brought to the attention of the healthcare provider or the poison center, some of which do end up in hospitals but are never recognized as being related to substance abuse, and therefore the poison center isn't called. And then we have the population that their first contact is with law enforcement. So, you know, we only have a little bit of data at the National Poison Centers because, you know, reporting substance abuse is not mandatory either by police or by healthcare providers. So you know, someone could be taken care of, a patient suffering from the effects of spice and or bath salts, but they may not be reported, and that limitation skews our ability to have really specific demographic data.
Okay, and then just one other question too. What about testing for bath salts and testing for synthetics like you know, K2 or spice?
They're typically missed in the vast majority of drug screens, including those that are run in just about every emergency department or intensive care unit or doctor's office around the country. Now, we're lucky that we have a very unique machine at our tox center and in our tox lab here at Good Sam with the Poison Center. The state lab has the same kind of capability, and often many law enforcement agencies can send off for these specific drug testing, but they're very labor-intensive, very expensive. The results typically come back in a delayed fashion. You know, here we can get the results back in 45 minutes, but most other hospitals in Arizona who send it out and don't send it to us get these results back in days. So the vast majority of drug screens done in healthcare facilities will come back negative. We can find it here, but like the agent was saying, we only look for methadone and MDPV. There are other substances that we have not put into our library yet and that are still missed.
Okay, great. Thank you. And so as we move forward then and hearing from Jim Molesa and hearing from Dr. Brooks, now the question is, you know, what can communities do? What can we do in our communities to help raise the level of awareness? Because if you're like me and maybe you do work in the drug prevention area, when you mention bath salts, the first thing that people think of is, oh my gosh, I better throw out that stash that I have from Bath and Body Works. And bath salts is a complete misnomer. So one of the things that we have to really do is educate people on, you know, what these synthetic drugs are, what spice is, what bath salts are truly, and to get some information. And some of the things that we can do is to educate, you know, parents and teachers, those who come into contact with young people. You know, Dr. Brooks had mentioned, you know, the average age was, you know, sort of in the 20s and 30s. You know, one of the things that we'd like to do is, you know, prevent children from ever using bath salts and synthetics like K2 or spice. But educate parents and teachers, because for a lot of parents, you know, this may not be on their radar screen. They may have heard a little bit about a synthetic drug, but they don't know that bath salts can have similar effects to cocaine and ecstasy and LSD. And then also communicate in public meetings or town hall events, or if you're a member of a drug-free coalition, you know, take the information. We're going to record this webinar, and feel free to share that link with others. Fact sheets are available. We have a PowerPoint available that you know, can be used as well. Also, some folks, and there are mixed opinions on this about legislate, because as we mentioned, you know, this is a race to always keep up. But recently, Cottonwood became the first city in Arizona to actually have a law against the use of synthetic drugs, such as bath salts and also K2 and spice. So I know that they have a great drug coalition there who would be willing to share you know, their ordinance if there are those who are interested in pursuing something similar to that. And then I think Jerome, it says, is going to follow right in the footsteps of, of cottonwood in going after bath salts. And the other thing that I'd like to mention is that I'm going to do a switch on my screen here, but the other thing that we're going to get as well coming up is the Arizona Criminal Justice Commission does their wonderful Arizona Youth Survey every other year. And in 2012, they're going to ask a question about synthetic drugs. So they're going to ask, on how many occasions, if any, have you used synthetic drugs, in your lifetime. And then they're also going to ask, about past 30-day use. So when that survey is released in 2012, we're going to be able to ask that question and to get those results. And so we'll have local data, so we'll be able to see. The great thing about that Arizona Youth Survey is that it really breaks it down into, people from Maricopa County can get specific numbers, or Mojave County, or Graham or Greenlee or Gila County, and so people will be able to see what the synthetic drug usage is for their counties, and that will also help address it and to work with, schools and that type of thing. One of the things to also think about is that school policies. A number of school policies, when synthetic drugs started showing up on campus, there wasn't anything specifically about a synthetic drug that was in their drug-free policy, and that was before these synthetics were made illegal. So one of the things that if you work with schools is to educate schools on these synthetic drugs and to also include bath salts or synthetic drugs in their drug policy for their school. Also, I'd like to show you, I'm going to take you out of this screen and show you some available online resources that you can use as well. We at DrugFreeAZKids.org have developed a number of pieces for you, everything from online resources and fact sheets to the PowerPoint that we have. And so I'm just getting it here as my screen changes. So what we have on our website at DrugFreeAZ.org is we have a section for parents which includes information on talking with your kids about drugs. And it can be everything from sample conversations, preschool, all the way to the college culture. And this synthetic drug conversation really does need to start taking place with our parents. So we have that information that's available to communities, and you can go online and you can print it or read it or share it. And then also what we have is a drug guide. On our drug guide, we have a number of different drugs that you can learn about. And so specifically, we added synthetic drugs. So once you click on synthetic drugs, you'll find information specifically on herbal incense and spice. We have it broken down into street or commercial names, what it looks like, how it's abused, Arizona teen facts. And then we've also created an herbal incense or spice or K2 fact sheet. These also can be used in community events to raise awareness about synthetic drugs. So feel free to use that information, from our website. Then also we have the information that we were just talking about bath salts and kind of the emergence of this. So there's a lot of great information on our website with regard to that. And then if you have folks that are let's say they're already using synthetic drugs, or they know or they think their child is using, again, under our Get Help section, there's some wonderful information for, I think my child is using drugs, or my child is using drugs. So a lot of online resources available to parents too, including an online learning center that we have where people can go and get information about a lot of different things and drugs and with regard to why teens use drugs and that sort of thing. So a lot of great resources online, and you can, of course, always call our office if you have questions or anything with regard to synthetic drugs or community education. So those are some of the synthetic drug resources that we have. If there are any questions, please feel free to go ahead and enter those into the question section of your webinar menu there.